Hello, my name is Vidyarthi Lakwani, and today I'm going to assess the thorax, cardiovascular, pulmonary, and peripheral system. This is my daughter Kirna. Do I have your permission to videotape you?
Yes.
Okay. So what I'll do first, I'll come in, knock knock. My name is Vidya, I'll be your nurse today. I'll clean my hands. And can you tell me your name and date of birth?
Kirna Lakwani, 6/13/1999.
And I'll verify that with her armband. And do you know what day of the week it is?
It's a Friday.
And do you know what month we're in?
May.
And what recent holiday we had?
Memorial Day.
Okay. Do you have any allergies to food, drugs, allergies?
None.
And any surgical medical history?
None.
Okay. All of this while doing having proper body mechanic with the bed elevated. I'll check her vital signs. It's within normal limit. Have you recently have shortness of breath? Any chest pain?
None.
Any tingling or numbness in your hands or feet?
No.
Okay. So first of all, I'm going to look at her chest area and I'm going to make sure it's symmetrical. Make sure there are equal expansion, and I'm going to look at front and back for kyphosis, lordosis, scoliosis, and I don't see any of that. And also I'm going to assess for pectus excavatum or pectus carinatum, which is sunken chest or like a bulging chest. I don't see any of that. Looks within normal limits. Everything looks normal. I don't see her being barrel chested. Checking her breathing. And her breathing is 16. Normal breathing is anywhere from 12 to 20. It's even unlabored, within normal limits. Next, I'm going to identify the anatomical landmarks. So we have the sternal notch, sternum. Then we have the sternal angle, xiphoid process, and the costal angle right here. To help listen at the sound, I will palpate for any bulges, any masses, bumps, lesion. And I don't feel any of it. So next, I'm gonna percuss the chest wall and see if there's no dullness. For quality, pitch, sounds. It's within normal limits. I didn't feel any dullness. Next, I'm going to listen or auscultate her breath sounds, and I'm going to start to her anterior breath, listening over clavicle for bronchial breath sounds, which is over the trachea. Right here will be bronchial vesicular breath sounds. And the rest are vesicular breath sounds. Her lungs are clear. There's no sign, no crackles, wheezing. There's no rhonchi. There's no pleural expansion or rub. So next we're gonna do the vocal resonance, and I'm gonna have you say the number 99, okay?
99, 99, 99, 99, 99, 99.
Okay, this is performing the bronchophony, or it gets muffled as we started going lower, which is normal. Next, we're gonna do the whisper pectoraloquy. Okay, and I want you to whisper 1, 2, 3. And I didn't hear any consolidation, so it's within normal limits. Next, we're gonna do, I'm gonna have you say the letter E, and we're gonna do egophony, okay? Just keep saying E, E. Okay. I could hear E clearly. If it was abnormal, it will sound something like an A rather than an E. So next we're gonna do, it's called tactile fremitus. So again, you're gonna say 99.
99, 99, 99, 99, 99.
Okay, and I can feel the vibration as as my hands are going down, which is within normal limits. Next, we're gonna listen and assess her back, inspect her back. So just put your feet. Okay. Okay. I'm gonna inspect her back, palpate for any masses, lesions, I don't feel anything. And I'm gonna also percuss, like how I did in the front. I'm gonna listen to you. Breathe in and out. Okay. Here I'll be assessing from C-spine to thoracic and bronchiovesicular and vesicular breath sounds. So next we're gonna do the cardiovascular. Can you turn around for me? Okay. So when the patient comes, I'm gonna assess her for any kind of surgery to see if she has any scar from pacer, a defibrillator, check her for jugular vein distension, carotid pulse. So I'm gonna check her pulse. They're equal bilaterally +2. I don't see any bulging or distension to either side. They're equal bilaterally. Next, I'm going to listen to her heart sound. To the aortic valve. Pulmonic. Tricuspid. And mitral. And I don't hear any murmurs. Everything is within normal limits. Next, I'll assess apical or the apex. Her pulse rate is 82 and normal is anywhere from 60 to 100. Next, I'm going to assess your their peripheries. So I have to take off your shoes. Put your feet here. Okay, I'm gonna assess your radial pulse. +2 bilateral brachial. Same, +2 bilaterally. I'm gonna check for capillary refill. Should be less than 3 seconds. Also, I'm gonna perform the Allen's test, which squeeze your hand, and I'm gonna occlude the radial ulnar artery. Open your hand. As you can see, it's blanching, and now it's pink. That means there's no occlusion and there's blood flow to her hand. And I'm gonna check pulses, popliteal pulse. I can feel it, it's +2. Next, Peter's pulse. And pop behind the ankle. +2. Check for capillary refill and clubbing on hands and feet. There's none. Check in for edema. There's no edema. So all is within normal limits. And also just as an assessment and education for cardiovascular, that's very important. You exercise, eat healthy, no junk food, eat a lot of vegetables, lean meat, drink water, and follow up with a primary care provider. That's it. Thank you.